Welcome to The Explainer. You mention healthcare or education at a dinner party, and boom, you've probably got a heated debate on your hands. But have you ever stopped to think about why? Why are these two topics, more than almost any other, such lightning rods in America? Well, today we're going to dig deep and get to the root of it all.
So what's really going on here? Turns out it's not just about dollars and cents or political parties. It's way, way deeper than that. We're talking about a fundamental clash over core American values. Let's break it down.
All right, so here's our game plan. We'll start with those two core values, then see how they play out in the fight over healthcare and the Affordable Care Act. After that, we'll pivot to education and the whole school choice debate, and then we'll tie it all together.
Okay, first things first, let's get right to the heart of this thing. The two competing philosophies that are really fueling all of this. Because if you can grasp this one central conflict, everything else we talk about today is going to make so much more sense.
So in one corner, you've got individualism. This is the idea that's all about personal freedom, self-reliance, and a deep-seated belief that the free market is the best way to solve our problems.
And in the other corner, you have a totally different idea, equality of opportunity. This view says that for society to be truly fair, we have a collective responsibility to make sure everyone has access to essential services. So let's put them side by side. On one hand, personal responsibility and market solutions. On the other, collective responsibility and government solutions. This right here, this is the fundamental tug-of-war in American social policy, and it's the engine driving these huge debates.
All right, so now that we've got the theory down, let's see how this clash plays out in the real world. First up, the epic battle over American healthcare.
The government wasn't always this involved in healthcare. It really kicked off back in the 1960s with landmark programs like Medicare for seniors and Medicaid for low-income Americans. And from there, well, the government's role just kept expanding.
And just look at this chart. The scale here is absolutely massive. Medicare, along with Social Security, takes up a huge slice of the federal pie. And as you can see, they're on track to just keep getting bigger and bigger.
By 2012, things had gotten, well, pretty extreme. The U.S. was spending over $8,000 per person on healthcare. That was the highest in the entire world, and not just by a little, but more than double the average of other developed nations. Just wow.
But here is the real kicker. Even with all that money flying around, by 2010, there were still nearly 50 million people in America without any health insurance at all. Something clearly wasn't working. The pressure was building, and the stage was set for a major, major change.
And that crisis is exactly what led to one of the most significant and, let's be honest, one of the most controversial pieces of social legislation in modern American history, the Affordable Care Act.
The ACA, which pretty much everyone knows as Obamacare, really shook things up. It introduced a ton of new rules, like requiring larger employers to offer insurance, expanding Medicaid, and creating popular protections like letting young adults stay on their parents' plan and banning denials for pre-existing conditions. Now, was the rollout perfect? No way. It was messy. We all remember the website crashes, and some people saw their premiums go up. It was a rough start, but you can't ignore the impact. By 2015, over 16 million people who didn't have insurance before finally had coverage.
But the real flashpoint, the thing that caused the biggest political fireworks, was the individual mandate, that requirement for everyone to buy insurance. For supporters, it was just common sense. If everyone's in the pool, costs go down for everybody. It's about that collective responsibility. But for opponents, it was a massive government overreach, forcing you to buy something. You see, this was a direct collision of those two core values we talked about.
Okay, so that's healthcare. Now let's switch arenas entirely and see how this exact same ideological fight is playing out somewhere else, public education.
So when we talk about applying free market ideas to education, the big buzzword is school choice. And the most controversial version of that is the school voucher, which basically uses public taxpayer money to help pay for private school tuition.
And would you look at that? The arguments for and against vouchers map perfectly onto those two values. Proponents say, hey, competition makes everything better. It'll force schools to improve. That's the free market individualism argument. Opponents fire back, saying it'll drain vital funds from public schools, hurting the kids who get left behind. That's the collective responsibility argument.
But it's not always so black and white in the real world. Take the story of Fannie M. Lewis. Here was a Democratic councilwoman in Cleveland, a devout Christian, who became a fierce advocate for school vouchers. Why? Because she saw the public schools in her poor community failing the kids, and she wanted a better option for them. It just goes to show you, these ideological boxes don't always fit real life.
So let's bring it all together. What's the big takeaway here? When you really step back and look at the big picture, you start to realize these aren't two separate debates at all. They're just two fronts in the exact same long-running American war of ideas.
Think about it. Whether we're talking about the ACA mandate or school vouchers, it all boils down to that same central tension. Individual liberty and free markets on one side, and equality of opportunity and collective action on the other. It's the same fundamental conflict, just wearing different clothes. So look, there are no easy answers here, but understanding this core conflict gives you a powerful new lens to see these debates through. It's not just about policy details. It's about who we are as a nation and who we want to become. And that leaves us with one final huge question. One that really gets to the very heart of the American experiment. When it comes to the things that matter most, like our health and our kids' education, which value should win out?